education is entertainment. So I hope you do enjoy listening to the video that we are going to talk about anticonvulsants. Anticonvulsant is a type of drug, and this drug is used to control seizures, to control convulsions uh, in human body or in human beings. But we have to know what is seizure or what is convulsion. Convulsion is like something like vibration in the human body. It's like vibration in the human body, but this vibration, our body starts vibrating without we want it, because our brain cannot control our body. So this is convulsion or this is seizure, Ceisure, seizure. So we are going to here talk about anticonvulsant drugs. That means the drugs that act against convulsion, or the drugs that uh, work to stop vibration in our body that we don't want. So this type of drugs are called anticonvulsant drugs. The newer anticonvulsant, we will talk about almost seven types of anticonvulsant drugs, and the history of these drugs, pharmacologic actions of the drugs, therapeutic indications of the anticonvulsant drugs, precautions, and we will also be talking about the precautions and adverse reactions of these drugs that we take for stopping convulsion or seizures. We will also be talking about drug interactions and the laboratory interferences. We'll also be talking about the dosages and clinical guidelines of these almost seven types of drugs, and all the types include a group that is called anticonvulsants. Okay, without wasting time, let's talk about anticonvulsants. I am reading this lesson from a book called Synopsis of Psychiatry. The book is written by Kaplan and Sadok. Benjamin James Sadok, MD, MD, Virginia Alcott Sadok, MD, and Pedro Ruiz, MD. This book is a book of psychiatry, and this book is published from all the doctors. Benjamin James Shadok is a doctor of New York University of School of Medicine, and Virginia Alcott Sadok is also uh, is a professor of psychiatry, Department of Psychiatry, New York University School of Medicine, and Pedro Ruiz, MD, is professor of psychiatry, Department of Psychiatry and Behavioral Sciences, University of Miami, Miller School of Medicine, Miami, Florida. So these all three doctors are from United States of America, and we are going to read about anticonvulsant drugs from this book. I do hope you are enjoying listening to this video. I think this video is very much essential for us, because nowadays, in the modern age, when we are living in the towns, we are living in the cities, our psychiatric problems are growing up. Our psychiatric problems are increasing day by day. So that's why I think we all should have some basic knowledge about how to stop the human body vibration that we don't know, that we cannot control, because our brain goes awry. Our brain cannot function smoothly and properly. So let's talk about anticonvulsants. I think this video will take about 1 hour or more. So I do think if you are keeping awake, please keep listening to this video. This will help you understand English, and this will also help you to be knowledgeable about some basic and fundamental medicines. The newer anticonvulsants described in this section were developed for the treatment of epilepsy. You see, epilepsy is a kind of convulsion, epilepsy is a kind of seizure, epilepsy is a kind of human body movement that when the body continues moving without his or her control. But were also found to have beneficial effects in psychiatric disorders, and In addition, these agents are used as skeletal muscle relaxants uh, and in neurogenic pain. These drugs have a variety of mechanisms, including increasing gamma aminobutyric acid or GABAergic or butyric acidergic function, or decreasing glutamatergic functions. This chapter includes six of the newer anticonvulsants, and the names of the anticonvulsants are gabapentin, or brand name is neurotonin, levetiracetam. The brand name is Keppra. Pregabalin is the generic name, and the brand name is Lyrica. Tiagabine is the brand generic name, and the Gabritel is the generic name. Topiramate is the generic name, and the brand name is Topamax. Zonisamide is the brand generic name, and the brand name is Zonigran, as well as one of the first used anticonvulsants, and that is phenytoin, which is a generic name, and the brand name is Dilantin. Carbamazepine is a brand name, and the generic name carbamazepine is a brand generic name, and the brand name is Tegretol. Valporate is the generic name, and the brand name is Dipaken or Dipacort. Lamotrigine is the generic name, and the brand name is Lamictal. Oxcarbamazepine is the all these medicines are discussed in separate sections. In 2008, the US or United States Food and Drug Administration, which is called FDA, issued a warning that these drugs may increase the risk of suicidal ideation. Suicidal ideation is the thinking or thought about killing yourself. That these drugs may increase the risk of suicidal ideation or act in some persons compared with placebo. However, the relative risk for suicidality was higher in patients with epilepsy compared with those with psychiatric disorders. However, some published data contradict the warning by the FDA regarding the use of anticonvulsants and the risk of suicidal thoughts. These studies suggest that anticonvulsants may have a protective effect on suicidal thoughts in bipolar disorder. Bipolar disorder is one of the most common psychiatric disorders commonly found in almost a majority of the population in the whole world. Considering the inherent increased risks of suicide in persons with bipolar disorder, clinicians should be aware of these warnings. So, this is the introduction on anticonvulsant drugs, and now let's talk about number one drug, that is gabapentin. What is gabapentin? Let's talk about gabapentin. Gabapentin was first introduced as an anti-epileptic drug and was found to have sedative effects that were useful in some psychiatric disorders, especially insomnia. Insomnia is the inability to sleep properly. Insomnia is when you cannot sleep properly, when you don't have sound sleep. This is insomnia. It was also found to be beneficial in reducing neuropathic pain, including postherpetic neuralgia. It is used in anxiety disorders, social phobia, and panic disorders, but not as a main intervention in mania or treatment resistant mood disorders. Now, let's talk about the pharmacologic actions of gabapentin. Gabapentin circulates in the blood largely unbound and is not apparently metabolized in humans. It is estimated unchanged by renal excretion and can be removed by hemodialysis. Food only moderately affects the rate and the extent of absorption. Clearance is decreased in elderly persons, requiring dosage adjustments. Gabapentin appears to increase cerebral GABA and may inhibit glutamate synthesis as well. It increases human whole blood serotonin concentrations. It increases human whole blood serotonin concentrations and modulates. Okay, 1 minute, please. And modulates. It increases human whole blood serotonin concentrations and modulates calcium channels to reduce monoamine release. So uh, it has anti-seizure or anticonvulsant as well as anti-spastic activity and anti antinoceptive effects in pain. That means these anticonvulsants are used sometimes for reducing pain in human body. Okay, let's talk about the therapeutic indications of gabapentin. Therapeutic indications means this drug is used for what kinds of diseases. In neurology is the science of neurons. A neuron is the you see texture of the connection between dendron and axons. In neurology, gabapentin is used for the treatment of both general and partial seizures. Seizures means convulsions. Convulsion means unwilling body movement. When you don't want, but your body keeps moving. So this is convulsion or seizures. It is effective in reducing the pain of postherpetic neuralgia and other pain syndromes associated with diabetic neuropathy. Neuropathic cancer pain, fibromyalgia, meralgia paresthetica, amputation, and headache. It has been found to be effective in some cases of chronic pruritus. Chronic pruritus. In psychiatry, gabapentin is used as a hypnotic agent because of its sedating effects, because gabapentin makes you go into sedation. It has anxiolytic properties. Anxiolytic properties means it removes your anxiety and benefits patients with social anxiety. If you are suffering from social anxiety, gabapentin helps you to be away, to keep aloof from anxiety or social anxiety and panic disorder, PD or panic disorder. It may decrease the craving for alcohol. If you are regularly using alcohol, this gabapentin medicine will decrease your craving, your desire for alcohol in some patients, and improve mood as well. Gabapentin can also improve your mood. Hence, it may have some use in depressed patients. That means if you are suffering from depression, you can also use gabapentin, which can help you. Some bipolar patients are benefited when gabapentin is used adjunctively, combinedly with mood stabilizers. That means if gabapentin and mood stabilizers medicines are used in conjunction, used together, bipolar disorder patients can have some benefits from using gabapentin and mood stabilizers. Okay, so this is all about therapeutic indications of gabapentin, and let's talk about the precautions and adverse reactions. No medicine is without adverse reaction or without reaction. As we know, the Newton's third law of motion, every action has its opposite and equal reaction. In the same way, in medicine, in pharmacy or pharmacotherapy or pharmacology or pharmacodynamics, all medicines have some side effects. So let's talk about the precautions and side effects of gabapentin. Adverse effects are mild. Mild means not as strong, something like weak or weaker, with the most common being daytime somnolence, ataxia, and fatigue. Fatigue means excessive tiredness, which are usually dose related. Overdose over 45 gram has been associated with diplopia, slurred speech, slurred screech. Screech is like a little bit shout. Lethargy is like is something like being overtired, and diarrhea. But all patients recovered. The drug is classified as pregnancy category C and is excreted in breast milk, so it is best to avoid it in pregnant women and nursing mothers. That means pregnant women and nursing mothers should not take gabapentin because it is categorized as pregnancy C. That means it is not legal. And since gabapentin can enter into breast milk to the fetus, to the baby, so it is forbidden for the mother who are breastfeeding and who are pregnant. Now let's talk about drug interactions of gabapentin. Gabapentin bioavailability may decrease as much as 20% when administered or given with antacids. In general, there are no drug interactions of gabapentin. Chronic use does not interfere with lithium administration. Chronic use, I mean long-term use of gabapentin, does not interfere with lithium administration. Lithium, lithium is a basic metal, but this lithium is used when you are suffering from different types of mania. So, in other sections, in other lectures, I will be trying to talk about lithium administration. Okay, let's talk about the laboratory interferences of gabapentin. Gabapentin does not interfere with any laboratory test, although spontaneous reports of false positive or positive drug toxicology. Toxicology is the science of poison. Screening for amphetamines, barbiturates, benzodiazepines, and marijuana have been reported. So these are the laboratory interferences. Now let's talk about the doses and clinical guidelines of gabapentin. Though this belongs to the doctors, but I am just reading them only for raising awareness among common people who are not doctors. Gabapentin is well tolerated, and the doses can be increased to the maintenance range within a few days. A general approach is to start with 300 mg on day 1, increase to 600 mg on day 2, 900 mg on day 3, and subsequently increase up to 1800 mg per day in divided doses as needed to relieve symptoms, to cure, to free symptoms. Final total daily doses tend to be between 1000 and 200 and 2400 mg per day, but occasionally results may be achieved with doses. Result may be achieved means result may be received. Achieved means got or gained. Gained with doses as low as 200 to 300 mg per day, especially in elderly persons and in the people who are elder or older. Sedation is usually the limiting factor in determining the doses. Sedation, if you are taking gabapentin, you have the possibility of going into sedation. Sedation is like sleep-like state. You can go to sleep if you take gabapentin. Some patients have taken doses as high as 4800 mg per day. This is the case of some patients. This is a rare case. Gabapentin is available as 100 mg, 300 mg and 400 mg capsules and as 600 and 800 mg tablets. 250 mg per 5 milliliter oral solution is also available. Although abrupt discontinuation of gabapentin does not cause withdrawal effects. Withdrawal effects means when you stop taking any medicine, you get some physical disturbances. This is called withdrawal effects or withdrawal symptoms. Use of all anticonvulsant drugs should be gradually tapered. Okay, so that's all about gabapentin. We talked about pharmacologic actions, therapeutic indications, precautions and adverse reactions, drug interactions, laboratory interferences and dosages, and clinical guidelines of gabapentin. So that's all about gabapentin. Let's talk about number two anticonvulsant drug, and that is topiramate. No, roommate. You see, if you share a room with someone or somebody with your friends, you say him or her as your roommate. So this is roommate, a little bit like roommate. This is topiramate. This is not roommate, but this is topiramate. Topiramate is the generic name and Topamax is the brand name. Was developed as an anticonvulsant and was found useful in a variety of psychiatric and neurologic conditions, including migraine prevention, treatment of obesity. Obesity is being extra fat, extra large, extra bulky, bulimia, binge eating, and alcohol dependence. Now let's talk about pharmacologic actions of topiramate. Topiramate has GABAergic effects and increases cerebral GABA in humans. It has 80% oral bioavailability and is not significantly altered or changed by food. It is 15% protein bound, and about 70% of the drug is eliminated by renal excretion, that means through urination, through making water. When you make urination, when you make water, 70% of the drug is eliminated through your body, is removed through your body. With renal insufficiency, if you have kidney problem, topiramate clearance decreases about 50%, so the dosage needs to be decreased if you have kidney problem. It has a half-life of around 24 hours. Now let's talk about the therapeutic indications of topiramate. Therapeutic indications means topiramate is used for what type of disorders or diseases. Topiramate is used mainly as an anti-epileptic medications and has been found superior, not inferior, but rather superior to placebo as monotherapy in patients with seizure disorders. If you are regularly going into seizure, going into convulsions, going into your body movement disorder, it is also used in the prevention of migraine. If you have chronic headache, this is migraine. It is also used in the prevention of migraine, smoking cessation. If you are smoking, you can use topiramate for your smoking cessation, quitting smoking. If you want to quit smoking, you should take topiramate. Pain syndromes, as for example, low back pain. If you are suffering from low back pain, post-traumatic stress disorder, or simply it is called PTSD, and essential tremor. Tremor is also like convulsion or seizure or unwanted, unwilling body movement of you. The drug has been associated with weight loss, and that fact has been used to counteract the weight gain caused by many psychotropic drugs. It has also been used in general obesity. Obesity is being extra bulky or extra fat, more than your BMI or body mass index. And in the treatment of bulimia and binge eating disorder, if you are suffering from eating disorder, this medicine can help you. Self-mutilating behavior may be decreased in borderline personality disorder. There are almost 10 types of personality disorders in psychiatry, and on the topic personality disorder, I have tried to make a video both in Bangla and in English. You can watch them from this channel. So it is of little or no benefit in the treatment of psychotic disorders. Psychosis or psychotic disorder, when you are suffering from hallucination and delusions, that means you are suffering from psychotic disorders. I have also tried to make some videos on psychotic disorder or psychosis. You can also watch them. They have been made in Bangla and in English. Whatever language you choose, you can watch those videos. In one study, the combination of topiramate with bupropion is another medicine used for quitting smoking or smoking cessation. The brand name is Wellbutrin, showed some efficacy in bipolar depression. But double-blind, placebo-controlled trials failed to demonstrate topiramate monotherapy efficacy in acute mania in adults. So that's all about therapeutic indications of topiramate. Let's talk about the precautions and adverse reactions. Adverse reactions of topiramate. The most common adverse effects of topiramate include paresthesias, weight loss, somnolence, anorexia, dizziness, and memory problems. Sometimes disturbances in the sense of taste occur. In many cases, the adverse effects are mild to moderate and can be attenuated. Can be lessened or shortened by decreasing the dose. No deaths have been reported during overdose. I mean, if you are accidentally taking any kind of overdose of topiramate, you don't have the possibility of being dead. The drug affects high acid-base balance, low serum bicarbonate, which can be associated with cardiac arrhythmias. Cardiac arrhythmias means it's like the irregular movement of your heart, irregular pulse of your heart, and the formation of renal calculi in about 1.5% of cases. Patients taking the drug should be encouraged to drink plenty of fluids. If you are taking topiramate, you should be drinking lot of fluids, lot of water. It is not known if the drug passes through the placenta or is present in breast milk. It should be avoided by pregnant women or nursing mothers. If you are pregnant with your baby, if you are breastfeeding your baby, you should not take topiramate because it is not known, it is not sure if it passes through the placenta. I would like to remind you that there are also some diseases related to placenta when any woman is pregnant or gravid with a baby in her womb. Placenta previa is a very serious disease, and because of placenta previa, if any woman develops placenta previa during her pregnancy, and if the grade is 3 or 4, she can anytime uh, develop bleeding, and the bleeding cannot stop. Sometimes death can occur. So everybody should be careful about placenta previa during pregnancy. So if you are planning to be pregnant, if you are having a baby, inside your womb, you should always try to consult a gynecologist and obstetrician. Okay, now let's talk about the drug interactions of topiramate. Topiramate has few drug interactions with other anticonvulsant drugs. Topiramate may increase phenytoin concentrations up to 25% and valproic acid 11%. It does not affect the concentration of carbamazepine, phenobarbital. Phenobarbital is a generic name and the brand name is Luminal. Thanks, Pro Hari Monirujjaman has made a comment. Thanks, good night. Pro Hari Monirujjaman, Kazi Nazrul Islam University, Trishal, Maimansingh, Bangladesh, Eid Mubarak. Okay, thank you, Eid Mubarak. Can I know, Pro Hari Monirujjaman, which subject are you studying in Maimansingh, Kabi Nazrul University? Please tell us which subject you are studying in this university, Kazi Nazrul University of Mymensingh, Trishal, Bangladesh. Okay, I think if you keep listening to this, Prohori Monirujjaman, you can improve your English. At the same time, you can have some glimpse of medical science. So that's why I am going to going to make this video on anticonvulsant drugs. Prohari Monirujjaman, I would like I would like you to say which subject you are studying in Kobi Kazi Nazrul Islam University, Trishal, Mymensingh, Bangladesh. Okay, let's talk about the drug interactions of topiramate. Okay, phenobarbital, pre-midon. Prohari Monirujjama has commented the Angel said to love man is to love God. Thanks. Okay, yeah. Loving human beings is loving God Himself, loving the Creator Himself. So we should have love for our fellow human beings. But if you look at the world, Israelis are fighting with the Palestinians, the Lebanese are fighting with the Israelis. People are not sympathetic to one another. So that's why I think fightings, conflicts, wars, revolutions are taking place in the world. Okay, let's talk about the drug interactions of topiramate. With topiramate, concentrations are decreased by read in the name of the Lord. Okay, read in the name of thy Lord. That means Ikra bisme rabbikal lazi khalaq. Read in the name of thy Lord, of thy Creator. Very good. Topiramate concentrations are decreased by 40% to 48% with concomitant administration of carbamazepine or phenytoin. Topiramate should not be combined with other carbonic anhydrase inhibitors such as acetazolamide or Diamox or diclofenamide or daranide because this could increase the risk of lithiasis or heat related problems. That means gohidrosis and hyperthermia. Okay, let's talk about the laboratory interferences of topiramate. Yes, thank you. Are you a famous principal? No, I'm not a principal. I am not a principal. I am just simply a teacher of one of the colleges of Bangladesh. I am not a principal. I don't know why you are guessing that I am a principal, famous principal. I'm not a principal. I am just simply a teacher, an ordinary teacher, a common teacher whom nobody knows, nobody watches, nobody sees. Okay, thank you, Prohari Monirujjaman, for your nice comment, for addressing me as a famous principal. I'm not. Okay. Laboratory interferences of topiramate, something like roommate. Topiramate does not interfere with any laboratory test. So that's all about topiramate. And now let's talk about the dosages and clinical guidelines of topiramate. Very thanks. Okay, super thanks. Mr. Prohari Monirujjaman, but one thing I wanted to know from you, which subject you are studying now in Kobi Nazrul University, Trishal Mymensingh? Which subject? What's the subject you are studying as your honors? Please tell us. The audience wants to know from you which the subject you are studying in this university. And I'd like to know from you because you are studying in Kazi Nazrul University of Trishal, Mymensingh. You know Kazi Nazrul Islam, the national poet and the rebel poet of Bangla literature, had been diagnosed with an incurable diseases. he was affected at the age of 43 or in 1942. Please tell me uh, what is the name of the disease Qazi Nazrul Islam had been suffering until his death? Prohori Moniruzzaman, I think you are listening to me. Which incurable diseases of Qazi Nazrul Islam had been suffering from until his death? Please tell us. The audience wants to know because you are the uh, diarrhea, easily bro, diarrhea. What's the meaning of diarrhea? I can't understand you what you are telling. Is it English or any other language? Please speak in language or in Bangla. Diarrhea. What country are you from? Easily bro. Diarrhea. Okay, Esli bro has made a very nice comment, diarrhea, but we don't understand diarrhea and English. What is English? English means what are you commenting here? I'm not sure. Please speak. Please write in English. It's poop. Oh, poop. Yes, poop. Okay, diarrhea is not poop, but diarrhea is the inability of holding your poop inside your gut or inside your bowel. When you have too much poop, it is diarrhea. Yes. When you have too much poop, it is diarrhea. Okay, if you want to be free from diarrhea, you should have your hands always clean before eating anything. You should always have your hands washed with soap or something like detergent. Okay, Ibli bro, what country, which country are you from commenting? Please tell us the name of your country where you are living or the country which is your native country. Please tell us. The audience of this channel wants to know. Easily, bro, Bangladesh, very good. Bangladesh is very good country. But your name seems to be something like foreign to Bangladeshi culture. Easily, bro, I think it's your social media name. Your name may be a little bit different from this. Okay, thank you for commenting, for having nice comment. My teacher Sumitra Monirujjaman, my teacher Sumitra Shikhar. Thanks, sir. Your teacher name is Sumitra Shikhar. Okay, Soumitra Shikhar. Okay, Gen Z world. Okay, yeah. It's the world of the generation G. It's the world of the alpha generation because Qazi Nazrul Islam has written a lot of poems about the young people of a particular community. Gen Z will reign over Bangladesh. Gen Z will be the dominator, will be reigning, will be dominating. But though dominating is is little bit bad word, but I would like to use in the good sense, the Gen Z uh, will control everything in Bangladesh. They will try to make a good revolution, good reformation, good change in Bangladeshi society. So wishing you all easily bro and Prohri Monirujjaman for your nice comments and super nice comments, I'd like to say. Okay, let's talk about the doses and clinical guidelines. We have been talking about topiramate. What is topiramate? Topiramate is a medicine that stops our unwilling body movement. When our brain cannot control our body starts moving, starts vibration. So this is called convulsion or seizure. And we are talking about topiramate is a drug that is used for stopping unwilling, unwanted body movement in human beings. Okay, let's talk about the doses and clinical guidelines of topiramate. Topiramate is available as unscored 25, 100, and 200 mg tablets to reduce the risks of adverse cognitive means brain related uh, Easily, bro, I'm in your house. What do you mean by I'm in your house? I'm not sure. Easily, bro, I'm in your house. That means I'm not sure. What do you mean by I'm in your house? Please clear your language. Topiramate is available as unescored 25, 100, and 200 mg tablets to reduce the risks of adverse cognitive means brain related and sedative effects means sleep related. Topiramate doses is titrated. Titrated means in chemistry there is an experiment which is called titration. প্রহরী প্রহরী মনিরুজ্জামান মাই টিচার খন্দকার আফরার ডিস্ট্রিক্ট অফ জামালপুর ওকে ভেরি গুড district of Jamalpur is situated near Mymensingh. Very good. Okay. Jamalpur is also located at the what's the name of the river? Brahmaputra. The Brahmaputra. Okay. Topiramate doses is titrated gradually over 8 weeks to a maximum of 200 mg. I'm in your toilet. Easily, bro. What do you mean by this? I'm your toilet. Please clear your language. Okay, 200 mg twice day. Off-label topiramate is typically used adjunctly means combinedly in combination with other medicine. Starting with 25 mg at bedtime. Bedtime means when you are going to bed, when you are going to sleep, and 150 mg per day at bedtime means when you are going to sleep. Okay, easily, bro. Okay, lots of love, lots of good wishes for you, easily, bro. Doses higher than 400 mg are not associated with increased efficacy. All of the dose can be given at bedtime. Bedtime means when you are going to bed for your sleep. To take advantage of the sedative effects. Persons with renal insufficiency should reduce doses by half. Renal insufficiency simply means if you are suffering from kidney related problem. So on the topic about anticonvulsant drugs, we have finished talking about gabapentin and topiramate. Now let's talk about the third drug. I am in all your walls. This is my wall. I cannot see you. You can see the sound of this wall. I cannot see you. I'm in your walls. I'm not sure what you mean by this. Okay, let's talk about I can see you. Yes, of course you can see me. Of course, easily, bro. Of course you can see me. Easily, bro. Okay, easily, bro. Keep commenting. Let's talk about the third drug that belongs to the I'm watching you while you sleep, of course, because this video keeps moving in the internet. When I am sleeping, people can watch me. When I'm having a nap, people can also watch me online. So you can do this. I'm watching you while you sleep. Very good comment. Very philosophical comment. It is not only a good comment, it's a philosophical comment that you are watching me while I sleep. Okay. So let's talk about question number 3. The drug number 3, tiagabine. Tiagabine. Prohari Monuruzzaman, Staff College, Mirpur Cantonment. Okay, very good. Staff, that means you are reading in Staff College, Mirpur Cantonment. Very good, very nice. Tiagabine. Tiagabine belongs to anticonvulsant drugs. That means tiagabine is used to stop our unwilling body movement. Tiagabine was introduced as a treatment for epilepsy. Epilepsy is also the unwanted, unwilling body movement. In 1997, that means almost 30 years ago, and was found to have efficacy in some psychiatric conditions, including acute mania. If you are suffering from mania, tiagabine can help you be free from mania. However, safety concerns, along with a lack of controlled data, have limited the use of tiagabine in disorders other than epilepsy. Okay, let's talk about the pharmacologic actions of tiagabine. Tiagabine is well absorbed with a bioavailability of about 90% and is extensively 96% bound to plasma proteins. Tiagabine is a cytochrome P4 P450 CYP3A substrate and is extensively transformed into inactive 5-oxotiagabine and glucuronide metabolites, with only 2% being excreted unchanged in the urine. Sir, your address. Prohori Monirujjaman, sir, your address. My address, you can see. Can you see the address here? I think you can see the address from my cap I am putting on. I think let's see you the address. This is the address. I think you can see it. This is the address. Okay. You can see it. I think. Let's talk about the pharmacologic actions. We have been talking about pharmacologic actions of tiagabine, one of the anticonvulsants drugs. The remainder is excreted as metabolites in the feces. Feces means poop. Feces means poop. 65% and the urine 25%. Tiagabine blocks uptake of the inhibitory amino acid neurotransmitter GABA into neurons and glia, enhancing the inhibitory action of GABA at both GABA A and GABA B receptors, putatively yielding anticonvulsant and antinociceptive effects, respectively. It has mild blocking effects on histamine 1, ACE1, serotonin type 1B, 5-HT1B, benzodiazepine, and chloride channel receptors. Okay, let's talk about the therapeutic indications of tiagabine. Tiagabine means thanks. You are a honest. Honest. I don't know honest. This is my address where I do my job as a teacher. Tiagabine is rarely therapeutic indications of tiagabine. Tiagabine is rarely used for psychiatric disorders, and then it is used only for generalized anxiety disorder or GAD, and insomnia. Insomnia is when you cannot sleep properly. Its main indication is in generalized epilepsy, when somebody is suffering from epilepsy. So in this case, we use tiagabine. Let's talk about the precautions and adverse reactions of tiagabine. Tiagabine may cause withdrawal seizures, cognitive or neuropsychiatric problems, impaired concentration, speech or language problems, somnolence, and fatigue. Fatigue means excessive tiredness. Status epilepticus, status epilepticus, and sudden unexpected death in epilepsy. SUDEP, sudden unexpected death in epilepsy. Be serious. You can have sudden unexpected death in epilepsy. Acute oral overdoses of tiagabine have been associated with seizures, convulsions, status epilepticus, coma, ataxia, confusion, somnolence, drowsiness, impaired speech, agitation, lethargy, myoclonus, stupor. Stupor is like little bit like coma. Tremors is also like human body vibration. disorientation, vomiting, hostility, temporary paralysis, and respiratory depression. When you have respiratory depression, that means you can also die. Deaths have been reported in polydrug overdoses involving tiagabine. So I think this is a very serious drug. Cases of serious rash may occur, including Stevens-Johnson syndrome. I'm not sure what is Stevens-Johnson syndrome. I will try to make another video on Stevens-Johnson syndrome. Tiagabine is classified as pregnancy category C because fetal loss. I means the fetus in your womb in a mother can die. And teratogenicity have been demonstrated in animals. It is not known if the drug is excreted in breast milk. That means if the drug is passing through breast milk to the fetus or to the baby. Pregnant women and nursing mother should not be given the drug. That means the pregnant woman and nursing mother should not take this drug. Okay, let's talk about the laboratory test of tiagabine. Tiagabine does not interfere with any laboratory test. So simple. Okay, let's talk about the doses and administration of tiagabine. Tiagabine should not be rapidly loaded or rapidly initiated because of the risks of serious adverse effects. In adults and adolescents 12 years of age or older with epilepsy who are also taking enzyme inducers, tiagabine should be initiated at 4 mg per day and increased weekly by 4 mg per day during the first month. The dose should then be increased weekly by 4 to 8 mg per day for weeks 5 and 6, yielding 24 to 32 mg per day administered in 2 to 4 divided doses by week 6. In adults but not adolescents, tiagabine doses may be further increased weekly by 4 to 8 mg per day to as high as 56 milligram per day. Plasma concentrations in patients with epilepsy commonly range between 20 and 100 ng per ml, but do not appear to be systematically related to anti-seizure effects and thus are not routinely monitored. So that's all about tiagabine, the third anticonvulsant drug. Let's talk about fourth anticonvulsant drugs, and that is and the drug name is levetiracetam. Levetiracetam. Our fourth drug is levetiracetam. Initially developed as a nootropic or memory enhancing drug, levetiracetam proved to be a potent means powerful. Potent means a strong or powerful anticonvulsant and marketed as a treatment for partial seizures. It has been used to treat acute mania and anxiety and to augment antidepressant drug therapy. Augment means increase antidepressant drug therapy. Let's talk about pharmacologic actions of levetiracetam. The central nervous system, or simply CNS, effects are not well understood, but it appears to indirectly enhance means increase GABA inhibition. It is rapidly and completely absorbed and peak concentrations are reached in 1 hour. Food delays the rate of absorption and decreases the amount of absorption. Levetiracetam is not significantly plasma protein bound and is not metabolized through the hepatic CYP system. Hepatic means liver. Its metabolism involves hydrolysis of the acetamide group. Serum concentrations are not correlated with therapeutic effects. So that's all about the pharmacologic actions of levetiracetam. Let's talk about the therapeutic indications of levetiracetam. levetiracetam. Therapeutic indication. The major indication is for the treatment of convulsive disorders, including partial onset of seizures, myoclonic seizures, and idiopathic generalized epilepsy. In psychiatry, levetiracetam has been used off-label to treat acute mania as an add-on treatment. Add-on treatment means assistant, something like assistant treatment for major depression, and as an anxiolytic means anti-anxiety agent. Okay, let's talk about the precautions and adverse reactions of levetiracetam. The most common side effects of levetiracetam are drowsiness, dizziness, ataxia, diplopia, memory impairment, apathy, and paresthesis. Some patients develop behavioral disturbances during treatment, and hallucinations may occur. Suicidal patients may become agitated. Note the language. Suicidal patients may become agitated, may become more furious, more furious, more ferocious. It should not be used in pregnant women or lactating women. That means a woman who is having a baby in her womb should not take levetiracetam, and a woman and a mother who is breastfeeding her baby should not take levetiracetam. Let's talk about the drug interactions of levetiracetam. Levetiracetam. There are few, if any, interactions with other drugs, including other anticonvulsants. There is no interaction with lithium. There is no interaction with lithium of levetiracetam. Let's talk about laboratory interferences. No laboratory interferences have been reported. Let's talk about dosages and clinical guidelines of levetiracetam. The drug is available as 250, 500, 750 and 1000 mg tablets. 500 mg extended release tablets, a 100 mg per ml oral solution, and a 100 mg per ml intravenous solution. In epilepsy, the typical adult daily dose is 1000 mg. In view of its renal clearance, that means if there is no kidney problem, dosages should be reduced in patients with impaired renal function. That means if you have kidney problem, the doses should be reduced. So that's all about the fourth drug that belongs to anticonvulsant drugs. Now let's talk about the fifth drug that belongs to anticonvulsant drugs, and the name of is zonisamide. Zonisamide. Used originally as an anticonvulsant for the treatment of seizure disorders, zonisamide was also found to be useful in bipolar disorder, obesity, and binge eating disorder. Pharmacologic actions. Zonisamide blocks sodium channels and may weakly potentiate dopamine and serotonin activity. It also inhibits carbonic anhydrase. Some evidence suggests that it may block calcium channels. Zonisamide is metabolized by the hepatic CYP3A system. So enzyme-inducing agents such as carbamazepine, alcohol, and phenobarbital increase the clearance and reduce the availability of the drug. Zonisamide does not affect the metabolism of other drugs. It has a long half-life of 60 hours, not 16, but 60 hours. So it is easily dosed once daily, preferably at night time. Let's talk about therapeutic indications of zonisamide. Its main use is in the treatment of generalized seizure disorders and in refractory partial seizures. In psychiatric, controlled studies found it to be of use in obesity and binge eating disorder. Uncontrolled trials have found it useful in bipolar disorder, particularly mania. However, further studies are warranted for this indication. Now let's talk about precautions and adverse reactions of zonisamide. Zonisamide is a sulfonamide and thus may cause fatal rash and blood dyscrasias. Although these events are rare, about 44% of patients develop kidney stones, very fatal news. The most common side effects are drowsiness, cognitive impairment, insomnia, ataxia, nystagmus, paresthesia, speech abnormalities, constipation, diarrhea, nausea, and dry mouth. Weight loss is also a common side effect of zonisamide, which has been exploited as a therapy for patients who have gained weight during treatment with psychotropics or, as mentioned above, have ongoing difficulty controlling their eating. Zonisamide should not be used in pregnant women or breastfeeding mothers. Breastfeeding mothers or pregnant women should not take zonisamide. Let's talk about drug interactions of zonisamide. Zonisamide does not inhibit CYP isoenzymes and does not instigate drug interactions. It is important not to combine carbonic and anhydrase inhibitors with zonisamide because of an increased risk of nephrolithiasis related to increased levels of urea. The laboratory interferences of zonisamide are: zonisamide can elevate hepatic alkaline phosphatase and increased blood urea nitrogen and creatinine. So little bit dangerous for the kidney. Let's talk about dosages and clinical guidelines of zonisamide. Zonisamide is available in 100 and 200 mg capsules in epilepsy. The dosage range is 100 to 400 mg per day, with side effects becoming more pronounced as at doses above 300 mg. Because of its long half-life, zonisamide can be given once a day. So that's all about the fifth drug that belongs to anticonvulsants. Now let's talk about the sixth drug, which is very well known as pregabalin or pregabalin. Pregabalin is pharmacologically similar to gabapentin. It is believed to work by inhibiting the release of excess excitatory neurotransmitters. It increases neuronal GABA levels. Its binding affinity is 6 times greater than that of gabapentin and it has a longer half-life. The pharmacological actions of gabapentin are: pregabalin exhibits linear pharmacokinetics. It is rapidly absorbed in proportion to its dose. The time to maximal plasma concentration is about 1 hour, and that to a steady state is within 24 to 48 hours. Pregabalin demonstrates high bioavailability and it has a mean elimination half-life of about 6.5 hours. That means 6.5 hours. Food does not affect absorption. Pregabalin does not bind to plasma proteins and is excreted virtually unchanged, less than 2% metabolism by the kidneys. It is subject to hepatic metabolism and does not induce or inhibit liver enzymes such as the CYP system. Dose reduction may be necessary in patients with creatinine clearance (CLCR) less than 60 ml per minute. Daily doses should be further reduced by approximately 50% for each additional 50% decrease. 50% decrease in creatinine clearance. Pregabalin is highly cleared by hemodialysis, so additional doses may be needed for patients on chronic hemodialysis treatment after each hemodialysis treatment. Now let's talk about uh, therapeutic indications of pregabalin. Pregabalin is approved for the management of diabetic peripheral neuropathy and postherpetic neuralgia, and for adjunctive treatment of partial onset seizures. It has been found to be of benefit to some patients with generalized anxiety disorder. In studies, no consistent dose response relationship was found, although 300 mg of pregabalin per day was more effective than 150 mg or 450 mg. Some patients with panic disorder or social anxiety disorder may benefit from pregabalin, but little evidence supports its routine use in treating persons with these disorders. It was most recently approved for the treatment of fibromyalgia. Fibromyalgia means chronic fatigue. That means you are getting tired for a long time. This is fibromyalgia. Let's talk about precautions and adverse reactions of pregabalin. The most common adverse effects associated with pregabalin use are dizziness, somnolence, blurred vision, peripheral edema, amnesia or loss of memory, and tremors or something like seizures or convulsions. Pregabalin potentiates sedating effects of alcohol, antihistamines, benzodiazepines, and other CNS or central nervous system depressants. It remains to be seen if pregabalin is associated with benzodiazepine type withdrawal symptoms. There are scant data. Scant data means very little data about its use in pregnant women or nursing mothers, and it is best avoided in these patients. That means pregabalin is avoided in pregnant women or breastfeeding mothers. Let's talk about the drug interactions of pregabalin. In view of the absence of hepatic metabolism, pregabalin lacks metabolic drug interactions. Let's talk about the laboratory preferences of pregabalin. There are no effects on laboratory tests. Okay, let's talk about the doses and clinical guidelines of pregabalin. The recommended dose for postherpetic neuralgia is 50 to 100 mg orally 3 times a day. The recommended dose for diabetic peripheral neuropathy is 100 to 200 mg orally 3 times a day. Patients with fibromyalgia may require up to 450 to 600 mg per day given in divided doses. Pregabalin is available as 25, 50, 75, 100, 150, 200, 225 and 300 mg capsule. And that's all about pregabalin, the sixth drug that belongs to the group anticonvulsant drug. Now let's talk about the seventh drug, phenytoin, and this is the last drug of the group anticonvulsant drugs. And by reading this, we are going to have a full stop to our lecture on anticonvulsant drugs. Phenytoin. Phenytoin sodium is the generic name, and the brand name is dilantin. Is an anti-epileptic drug and is related to the barbiturates in chemical structure. It is indicated for the control of generalized tonic-clonic grand mal and complex partial psychomotor temporal lobe seizures and prevention and treatment of seizures occurring during or after neurosurgery. Neurosurgery means brain surgery. Studies have shown comparable efficacy of phenytoin to other anticonvulsants in bipolar disorder, but clinicians should take into account the danger of gingival hyperplasia, leukopenia, or anemia, and the danger of toxicity caused by non-linear pharmacokinetics. Let's talk about the pharmacologic action of phenytoin. Similar to other anticonvulsants, Phenytoin causes blockade of voltage-activated sodium channels and hence is efficacious as an anti-manic agent. Anti-manic agent. The plasma half-life after oral administration averages 22 hours with a range of 7 to 42 hours. Study state therapeutic levels are achieved at least 7 to 10 days, 5 to 7 half-lives after initiation of therapy with recommended doses of 300 mg per day. Serum level should be obtained at least 5 to 7 half-lives after treatment initiation. Phenytoin is excreted in the bile, which is then reabsorbed from the intestinal tract and excreted in the urine. Urinary excretion of phenytoin occurs partly with glomerular filtration and by tubular secretion. Small incremental doses of phenytoin may increase the half-life and produce very substantial increases in serum levels. Patients should adhere strictly to the prescribed doses and serial monitoring of phenytoin levels is recommended. Now let's have a glimpse of the therapeutic indications of phenytoin. Apart from its indication in generalized tonic-clonic grand mal and complex partial psychomotor temporal lobe seizures, phenytoin is also used for the treatment of acute mania in bipolar disorder. Let's talk about the precautions and adverse reactions of phenytoin. The most common adverse reactions reported with phenytoin therapy are usually dose-related and include nystagmus, ataxia, slurred speech. Slurred speech means slow speech. Decreased coordination and mental confusion. Other side effects include dizziness, insomnia, transient nervousness, motor twitching, and headaches. There have been rare reports of phenytoin-induced dyskinesias similar to those induced by phenothiazine and other neuroleptic drugs. More serious side effects include thrombocytopenia, leukopenia, agranulocytosis, pancytopenia with or without bone marrow suppression. Very, very dangerous news. Very, very dangerous side effects. A number of reports have suggested the development of lymphadenopathy, local or generalized, including benign lymph node hyperplasia, pseudolymphoma, lymphoma, and Hodgkin's disease. Hodgkin's disease is a very little bit common and rare disease, but I will be trying to have a video on Hodgkin's disease or Hodgkin's disease. Prenatal exposure to phenytoin may increase the risk for congenital malformations and a potentially life-threatening bleeding disorder related to decreased levels of vitamin K-dependent clotting factors may occur in newborns exposed to phenytoin in utero or the uterus. Hyperglycemia has been reported with phenytoin use. In addition, the agent may increase the serum glucose level in patients with diabetes. Now let's talk about the drug interactions of phenytoin. Drug interactions of phenytoin include acute alcohol intake, amiodarone, chlordiazepoxide, cimetidine, diazepam, disulfiram, estrogens, fluoxetine, H2 antagonist, isoniazid, methylphenidate, phenothiazines, salicylates, and trazodone may increase phenytoin serum levels. Drugs that may lower phenytoin levels include carbamazepine, chronic alcohol abuse, and reserpine. Let's talk about the laboratory interferences of phenytoin. Phenytoin may decrease serum concentrations of thyroxine TSH, FT4 belongs to the thyroid gland. It may cause increased serum levels of glucose, alkaline phosphatase, and gamma glutamyl transpeptidase. Let's talk about the doses and clinical guidelines of phenytoin. Patients may be started on 100 mg extended oral capsule 3 times daily, and the doses then adjusted to suit individual requirements. Patients may then be switched to once a day dosing, which is more convenient. In this case, convenience means helpful. In this case, extended release capsules may be used. Serial monitoring of phenytoin levels is recommended, and the normal range is usually 10 to 20 microgram per milliliter. Mu-Z, microgram per milliliter. So that's all about the 7 items of drugs: pregabalin, zonisamide, levetiracetam, tiagabine, topiramate, and gabapentin. All these 7 drugs belong to a group which is called anticonvulsant drug. So once again, I would like to repeat that the newer anticonvulsants described in this section were developed for the treatment of epilepsy, but were also found to have beneficial or good effects in psychiatric disorders. So that's all about the anticonvulsant drugs. And in this chapter, we talked about 7 types of medicines that belongs to anticonvulsant medications or drugs. So I do hope you did enjoy listening to this lecture. This lecture will not only help you be conscious or careful about medicine, but also this lecture will help you be a good listener of English, and it will help you be a good speaker. And if you practice writing on your script, I think you will be a good writer. So wishing you all good health, good hygiene, and a good future. I would like to put an end to this video. Wishing you all bye bye. Thank you very much, and keep watching the channel of this video. Thank you.